Assalamu alaikum. My name is Dr. Baneen Abbas. I have done BDS from Karachi Medical and Dental College in 2020 and currently doing MPhil from Department of Physiology, University of Karachi. Today, I am here to present my research poster on the topic of exploring the therapeutic potential of AZADIRACTA indica in alleviating ligature-induced periodontitis in rats. This study was aimed to investigate the effectiveness of AZADIRACTA indica, that is commonly known as neem plant extract, on periodontal infections, highlighting its potential as an inexpensive, risk-free alternative to expensive allopathic medications. As we all know that antibiotic resistance has increased worldwide, so natural herbal remedies provide resistance-free alternative to them. First of all, we all should know that what is periodontitis. Periodontitis is a chronic gum infection that involves tooth and its supporting structures, leading to tooth loss, bone loss, and loss of overall well-being of an individual. It presents with bleeding gums and plaque deposition in initial stages, and in severe cases, tooth mobility due to loss of alveolar bone. It affects around 19% of adult population worldwide, according to WHO Fact Sheet 2022. Herbal remedies like neem are widely used for health benefits that are rich in bioactive compounds found in different parts of a plant. These natural options, rooted in ancient culture and diverse diverse practices, offer prevention and treatment for various illnesses, promoting overall well-being. This study aimed to evaluate the therapeutic potential of AZADIRACTA indica in alleviating inflammatory cells, that is, neutrophils in the blood of ligature-induced periodontitis rats. As through research, we got to know that neutrophils are the first line of defense in inflammation. So, for this, 36 albino visitor rats were divided into 6 groups, and each group contained 6 rats. Group 1 remained untreated. In group 2, ligature-induced periodontitis was done by tying 5-0 silk ligature around mandibular incisors for 7 days. Group 3, ligature-induced periodontitis was done for 14 days. Group 4, Group 5, and Group 6 were treatment groups in which the extract was given. In Group 4, AZADIRACTA indica plant extract of 300 mg per kg body weight was given orally via gavage after 7 days of ligature placement for 7 days. Similarly, in Group 5, a ligature-induced periodontitis was done for 7 days, and then 500 mg per kg of AZADIRACTA indica plant extract was given orally via gavage for 7 days. In Group 6, ligature-induced periodontitis was done, and then metronidazole in 100 mg per kg of body weight was given. As we know that metronidazole is the drug of choice for treating periodontal infections. Now, come to this chart. Neutrophils are plotted against y-axis and experimental groups are given on x-axis. This chart shows the effect of AZADIRACTA indica for 7 days on neutrophils, 2 different doses. For this, when we compare the group 2 with group 1, we can see a rise in neutrophil count, but this rise is non-significant. When we compared group 3 with group 1 and group 2, a rise in neutrophil count can be seen, but this rise is also non-significant. When we compare group 4 with group 1, group 2, and group 3, we can see a reduction in neutrophil count, but this reduction is non-significant. When we compared group 5 with group 1 and group 4, a non-significant reduction can be seen, but a significant reduction can be seen when compared with group 2 and group 3. In group 6, we can see a non-significant reduction in neutrophil count when compared with group 1, group 2, and group 3, but a non-significant increase in neutrophil count when compared with group 4 and group 5. This proves that 500 mg per kg of AZADIRACTA indica plant extract for 7 days significantly attenuated the infiltration of inflammatory cells, that is neutrophils, in blood of periodontitis-induced rats as compared to other groups. In these pictures, we can see on day 0, when we were tying the ligature, we can appreciate healthy gingiva. On day 7 of ligature placement, we can easily see the bleeding gums. On day 14, we can see bleeding gums plus slight edema around the teeth. And this 500 mg per kg AI AZADIRACTA indica group, the gingiva was similar to the day 0 gingiva, that is, it was almost normal. So we concluded that AZADIRACTA indica plant extract has significant effects on reduction of inflammatory cells in blood of periodontitis-induced rats, and that it possesses antimicrobial and anti-inflammatory action. Thank you so much.